Our program here at Williams Cardiology and Wellness mainly focuses on nutrition, but we also encourage people to look at it more holistic and realize that, you know, there's a couple of key pillars that really are really important for overall health. One of them is regular exercise, not because the exercise itself, again, is going to hugely reduce your cardiovascular risk, but it will tend to improve the quality of life by improving your mental health, improving your focus, just improving the quality of your sleep. The other thing is regular sleep and maintaining a regular sleep pattern, and we incorporate, you know, lessons about this into our Lunch and Learn program as well. If your sleep is not right, then basically the human body is under stress again, and when the human body is under stress, nothing seems to go right. Everything from blood sugar levels to ability to focus, motivation to be active and exercise. So it's really impossible to extract any one of these aspects of holistic health and just focus on them alone. So they all sort of need to be addressed. But to a new person who's very unhealthy, overweight, not getting regular sleep, and not eating well, taking them all on at once can be overwhelming. So we sort of artificially need to take them out individually and focus and educate people on different aspects of it. You know, in other cultures, including in Europe, the concept of having a gym membership is considered sort of farcical and comical, because generally in a number of other cultures, people tend to be more active naturally, walking their dog, they tend to walk more and so forth. And they also, in hand, they tend to eat better and actually tend to have more diets that are plant-based. That tends to be related to mental health, because if you have a regular dietary habit that's healthy, that generally results in more steady blood sugar levels, and big swings in blood sugars tend to be associated with a stressed situation, which then you know, upsets the person, reduces their ability to focus, reduces their mood, results in mood swings. And while all that energy is being burnt, that's less energy you can have towards meal planning and focusing on self-care. So it all tends to snowball together, both in the good direction and in the bad direction of one aspect of this is not addressed. Psychologist Jordan Peterson describes this in a number of books he's written, whereby if he has a patient with significant depression, and one of the first things he asks them is, how's your sleep? Do you get up at the regular time, or the time that most people get up during the day? Going to bed at a regular time is important, but it doesn't seem to be as important as getting up at the regular time each day and making a pattern. And the second question he asks him is breakfast. Do you eat breakfast? Because if you miss breakfast, again, and put yourself into a starvation state, which again by definition is a stress state, that will then result in blood sugar swings, a stress situation, and even once you're in that state of large blood sugar swings and a cortisol stress reaction, even if you eat then to address the hunger, you can't reset that state until you sleep again. So all of these things about regular sleep, exercise, regular eating, they're all intrinsically but difficult to point out how they're related to mood and overall health. Hence, we do need to address them all. But the key one, I think, again, is if you don't have your nutrition right, you have large swings in your blood sugars, then that kind of wears you out. You don't have any energy really to plan regular sleeping patterns, regular activity. Your motivation is down, your quality of life is down, you're going to get anxious and depressed, and then it starts to snowball in a negative way. But nutrition is a very important place to start. So that's why we focus on nutrition so much.